In chapter 23, we are looking at infections of the urogenital system. So with the urogenital system, one thing that will increase the risk of infection is that they have openings to the external environment. So obviously that's going to increase your risk. There's a normal microbiota there, meaning normal microorganisms that exist there. If those get out of balance, that's going to increase your risk of infection. Oftentimes, if you're taking antibiotics or there's a change in diet or a change in hormones or stress levels, that can upset that normal balance there and kind of tip it one way or the other, and maybe increase chances for bacterial infections, or the reverse, maybe increase chances for fungal infections. UTIs, urinary tract infections, that's one of the most common infections that we find. The urinary system, you've got the bladder and the urethra are the most common sites for infection because that's what's closest to the external environment. In the male reproductive system, the urethra, the testes, prostate gland, and epididymis are also common sites for infection. In the female reproductive system, the vulva, vagina, cervix, and fallopian tubes are the most common sites for infections to occur. With the urinary system, you have just basic anatomy here. Your kidneys, they are filtering the blood. They're involved with helping to maintain acid-base balance. They're helping to keep you hydrated. The nephron is the functional unit of the kidney. This is where the first step occurs in terms of filtering the blood, which involves in the production of the urine. The ureter connects the kidney to the bladder, so the urine that's produced in the kidney is going to flow through the ureter down to your urinary bladder, which then stores that urine until you expel it, and it's going to be expelled through the urethra. The urethra is much shorter in females versus males, and so for that reason, bladder infections are more common in females than they are in males. And so in this simple diagram, it's just showing, just as a reminder for you, that you have your kidneys and the urine's going to be produced here, go down through the ureter till it gets to the urinary bladder, and then finally it's released through the urethra. In this picture over here of the kidney, you've got the kidneys divided into these different lobes or sections. Within each lobe, you have actually, within each kidney, millions of these nephrons. The nephron is the functional unit for the kidney. Like I said, this is where the blood's going to come in, and right up here is where, this is called the glomerulus, where you're going to filter the blood, and this is where you start producing the urine. It's then going to move down through these tubules and back up and then around through here and ultimately down through this section, which is then going to, all this is occurring in this area. And so then the urine that's been produced is going to pass through this area of the kidney and then finally out into the ureter. For the male reproductive system anatomy, the testes is where the sperm is produced, the epididymis is where the sperm is going to mature, and it's going to connect to the vas deferens. The seminal vesicles are an accessory gland. The prostate gland is an accessory gland. In the urethra, that's actually transporting not only the semen but also the urine through the penis. For the female reproductive system, the vulva is the external genitalia, and then the vagina, also commonly referred to as the birth canal, that connects to the cervix, which is the opening to the uterus. The uterus is the site where if fertilization has occurred, this is where fetal development is going to occur. The fallopian tubes are where fertilization occurs. In the ovaries, that is where the eggs, or scientifically we call it the ovum, that's where those are produced. And if we look at the structures over here on the left with the female, you have the ovary, you've got the fallopian tube, here is the uterus, the cervix, the vagina, and out. One thing is, since we were talking about the urogenital system, is just to note, here is the opening for the anus where all your waste products are coming from the intestines ultimately, and then here is the vagina, up here is the bladder. So yes, women have 3 openings. The reason I am mentioning this is that it is very important. We always teach little girls when they're learning to go to the bathroom by themselves is to always remember to wipe from front to back. And just so you know, that is something that with geriatrics, you may have to remind your older women of this, because sometimes they kind of revert back to childhood and they forget. The reason you're going from front to back is you don't want to go from the back to front, because you don't want to bring any potential bacteria or contaminants, fecal matter from the anus up to either the vagina or to where it can travel up to the urinary bladder. The urethra is right here. Notice how short it is to get to the bladder. That's why I said bladder infections are more common in females than males. For males, you have your urinary bladder, which is right here. And then the urethra comes down and it's come all this distance down through the penis and then finally out. So it's a much longer distance. So anything coming from the outside environment and moving in, it's got a long ways to go. That's why they're not nearly as common in males. In terms of the reproductive structures in the scrotum sac, the testes are here, and then the epididymis right next to it, where the sperm are going to mature, and then they're going to move up the vas deferens around, that goes over the top of the bladder, comes around. Now in this area, and here's the prostate gland. This is the seminal vesicle up here that I drew first. And then there's what's known as the bubble urethra or Cowper's glands. 1, 2, 3. So this is 1, 2, and 3 are accessory glands. So now the sperm, it's going to go through here. You're adding fluid to it, and then it's going to come out through the penis as well. Another thing just to note here, in terms of the reproductive structures, notice that most of the female reproductive structures are internal. The majority of the male reproductive structures are external. And why is that important? Are you able to see symptoms of diseases, especially some of your sexually transmitted diseases? A lot of those are typically asymptomatic in females. You can't see that the ovaries are infected. You can't see that the vagina is infected. But you can see the penis, so you can see that it's infected or that it has lesions on it, etc. And so that becomes an issue, certainly with a sexually transmitted disease. It's important that you treat not only the individual, but their partners as well. So the normal microbiota in terms of the urinary system, the kidneys should be sterile. They're so far internal that they should be sterile. Now the bladder and the urethra, what we're finding on some new studies is that they do have some bacteria in them, but it shouldn't be heavily colonized. With the reproductive system, females, the vagina tends to be colonized shortly after birth. For males, the distal end of the urethra, that's the very end of it, has some bacteria. Once again, the further you go internally, the less there should be. For urinary infections, cystitis is inflammation of the bladder. Urethritis is inflammation of the urethra. Ureteritis is inflammation of the ureter. Pyelonephritis is inflammation of the kidney. And glomerular nephritis is inflammation of the glomerulus or the nephron. Continuing on, epididymitis is inflammation of the epididymis. Orchiditis is inflammation of the testicle. Prostatitis is inflammation of the prostate gland. Vaginitis is inflammation of the vagina. Vaginosis is a bacterial infection of the vagina. You have yeast infection. Remember, yeast are fungi, so that'd be a fungal infection. Salpinginitis is inflammation of the fallopian tubes, and PID, which stands for pelvic inflammatory disease, that's where you have an infection within the pelvic cavity, so it's going to include infections of the uterus, the cervix, fallopian tubes, and ovaries. So what are some of the risk factors for females for getting urogenital infections? Hormonal changes, because that's going to potentially alter the balance of the normal microorganisms that are existing in the vaginal area. For males, some risk factors are if you have an enlarged prostate gland or if you have kidney stones. And for males, certainly if there is a urinary catheter placed in, anytime you have a catheter placed in, you want to have it in for as short a time as possible. The longer it stays in, the greater chance you have of increasing your risk for infections. So if we start with the bacterial infections, cystitis, this has several different bacteria that can cause it. You can see I decided on this one. I felt it was easier just to separate it by the gram-positives and gram-negatives. So your gram-negative bacteria include your E. coli, Proteus vulgaris, Pseudomonas aeruginosa, and Klebsiella pneumoniae. For the gram-positives, we're talking about Staphylococcus saprophyticus, Enterococcus faecalis, and Streptococcus alcalacea. All of these can be treated with antibiotics. Now, if you suspect that somebody has some type of a urinary tract infection, what you're going to do is collect a urine sample, and then you use this dipstick. You take this, and there's different brands of these. This one just has 4 tests. Some of them have up to 10 tests. So it just depends on which one your lab uses. So you take this strip of paper here, and then you just stick that in the urine, and then you compare. You line it up. And usually these are on the side of the bottle. So you're going to line up and compare the color with the color marking. Now, to me, this looks closest to here, which now I can't see, and every brand organizes them a little bit differently. So I don't know particularly what test this is, but whatever it is, it's a negative. This one right here, you would compare the color. Looks to me pretty close to here, which is also a negative. This one right here, I would say it's closer to this one, which is 0.3, but I don't know what we're testing for right there, because like I said, over on the side it should be listed. And this one right here, that looks closer to right here. It says 7. I'm guessing this one's pH. So you just line it up and you just compare the color with it. So you can test on there for things. Are there proteins? Is there glucose? You test for the pH. You can test for, is there blood in the sample? So there's a whole list of different things you can test for. You know what the normal ranges for each of those tests should be. So if it's an abnormal range, okay, let's see what's going on. When you collect the urine sample itself, you've all seen the pee cups. In the lab, and this might sound a little strange, but you're going to notice when it's brought in, number one, the color. Is it real light or is it real dark? That gives you clues as to whether the individual is dehydrated or not. You're going to notice the odor. You're going to dip your dipstick into it. One thing you look at, when you look at the color, notice on here, is it cloudy or is it clear? If it's real cloudy, remember, cloudiness or turbidity tends to indicate bacteria. There should not be bacteria in there. Okay, so notice those things. And this on the right side over here is showing where they took a sample of the urine and they plated it, and this is what grew. So now you get to figure out what that is. Because once again, there shouldn't be bacteria in there. With the kidney, you can have a couple different types of infections, pyelonephritis and glomerulonephritis. Both of these are involving the nephron, that functional unit. Some bacteria that can cause these types of infections are E. coli, which is gram-negative, Streptococcus pyogenes, which is gram-positive, Proteus, which is a gram-negative, and Klebsiella, which is also a gram-negative. And yes, there are antibiotics to treat all of these. Leptospirosis is caused by the Leptospira species. There's several different species of this bacteria. It's a gram-negative. It is a spirochete. It's fairly common in soil. It's also common in animals, both in the tropical areas. How do you contract it? Usually you come in contact with contaminated soil or contaminated water. Which type of group of people are at higher risk? It'd be those that are working with animals or animal products in these tropical areas. You can't treat it with antibiotics. Now, it is a spirochete, so when you look at it, spirochetes are often easier to be seen under dark field. Remember, this is where the background is staying this dark color, and so it looks like the colorless are all of these white. There's an awful lot of them in here. You should not be seeing each one of these right here, little white squiggly lines. That's a separate bacteria. This is from a scanning electron microscope, this micrograph, which is just the picture of it. You can definitely tell that it's a spirochete. I mean, it looks kind of cool, you know, little curling spirals on it, as long as it's not in you. Non-gonococcal urethritis, or NGU. This is often asymptomatic, or if you do have symptoms, it's usually very mild. This can be caused by chlamydia trachomatis, which is gram-negative. It can also be caused by Mycoplasma genitalium, Ureaplasma uroliticium, and Mycoplasma hominis. Those last three ones here. These are classified as bacteria. However, they're in a family where they do not have a cell wall, therefore they have no gram stain. They still respond to antibiotics as well as the chlamydia, so you can treat all of these with antibiotics. This is showing one of the ones that doesn't have a cell wall around it. Vaginosis, the bacterial infection of the vagina, often is due to where that normal environment of microorganisms gets off balance. And for various reasons, like I said earlier, it could be hormonal, it could be stress. You could have been on maybe antifungal medicine. In this case, what happens is the pH increases. Normally the vagina is slightly acidic. The pH increases. Fungi don't like that, so it shifts the balance more towards the bacteria. Sometimes the symptoms can be asymptomatic or just very mild. Oftentimes treatment is not necessary. If it gets a little more annoying than anything, you could treat it with antibiotics, but usually you just treatment is not necessary. The bacteria that can cause vaginosis, Gardnerella vaginalis, which is a gram-negative. This is the most common cause of it. But also Bacteroides species, which is gram-negative. Prevotella species, which is gram-negative. Mobilusis species, which is gram-positive. And Fusobacterium species, which is gram-negative. All of those can be causative agents. Now, sometimes, how do you identify this? Sometimes when they're growing, they do cause abnormal structures with the normal cells. So here are some normal cells. Notice how this cell is so much larger. It's what you call a clue cell. There's something going on there. That's not normal. Do further testing to figure out which one of those previous bacteria is causing the problem. Neisseria gonorrhea. This causes gonorrhea. The old name way back was CLAP. It's a gram-negative coccus. This is often asymptomatic and then can spread to other areas of the body. You can treat it with antibiotics. One of the concerns is that there is an increase or a growing problem of drug resistance, which means you need to make sure if you're going to treat it with the antibiotic, which you need to, that is not a drug resistant strain to that particular antibiotic. You may need to change it. So monitor that closely. So Neisseria gonorrhea, in a male, you often see a discharge from the penis. In the female, you may have discharge coming from the cervix, and in the vaginal area, once again, because it's internal, that may be harder to detect in a female. Neisseria gonorrhea, well, Neisseria, any of the species in general, like I say, they're gram-negative and they're cocci. Typically, they occur in pairs, which is what it's trying to show up here. So you see in pairs, and sometimes it's kind of described as, and I can't draw very well, but sort of looking like kidney beans, where they're, if you put them side to side with the curvature inward, that's often how they look. So sometimes they're described as a diplococcus because you have two of them together. There are very few gram-negative cocci that are pathogenic. And if you see that, probably, if I did a gram stain and I saw a gram-negative cocci, my first guess is going to be Neisseria. And if I see it where it's in a pair, it looks like a pair of kidney beans, I'm definitely going to be thinking Neisseria. Obviously, you would run additional tests to prove that. Chlamydia trachomatis is gram-negative. It's causative agent of chlamydia. This is the most common STD reported. It's very widespread. It's easily transmitted from one sexual partner to another because it's often asymptomatic, so the person doesn't know that they have it, so therefore they don't know they're transmitting it to someone else. You can treat this with antibiotics. Once again, any of your STDs, you need to be treating all partners. I can remember talking with a friend of mine who works for the Angelina County Health, and shortly after we came out of the quarantine time, after the COVID pandemic, and I was talking with her and just saying, are you seeing cases of COVID finally, coming down overall? That's what, we're expecting to see. And she's not a nurse, but she was talking to one of the nurses with the county health and was commenting, I guess, to her about, are you seeing, a number of cases of COVID? And her response was, right after we came out of the required quarantine time, where the nurse said, COVID is not exactly the problem right now. I mean, we're still seeing high numbers and we want them to come down, obviously, and that's what everyone's been hoping for. It's come down enough so we no longer have to be in quarantine. But after being in required quarantine for a couple months, she goes, now the problem that we're having in both Angelina County and Natchitoches County is there was a surge in increase in some of the STDs. And the nurse is like, we all ended up kind of talking. I was like, I don't know what people are doing. I don't want to know what people are doing, but now we have another problem. So this is showing what the chlamydia looks like under the microscope. It often triggers swelling of the lymph nodes in the groin area, and you get those bulbos. Bulbos is a swelling of the lymph nodes there. Treponeme pallidin, this is also gram-negative. It is also a spirochete. It is the causative agent of syphilis. Syphilis is divided into 3 different stages. Typically, you go through stage 1, then stage 2, and then it goes latent. One of the problems with syphilis is that it can cross that placental barrier and have devastating effects on the developing fetus. You can treat it with antibiotics. This is showing some of the different stages of syphilis, where you have the classic lesions that you see You can also have a rash on the hands, and then lesions, it travels elsewhere in the body. This is showing on the nose, an open lesion. Under the microscope, once again, spirochetes often are easier to see under dark field. So this under A is a good example. You can definitely look at that white structure because the background stains back. The bacteria is colorless, so it looks white there. But you can definitely tell that it's a spiral shape. Over here on B is where they did a silver staining. And so all of these darker, almost brownish color, these are all the Treponema bacteria. You can see there's a lot of them in here. You can also tell that they have that spirochete shape to them. Haemophilus ducreyi is a gram-negative bacillus. It also causes a chancroid. It can be treated with antibiotics. And this is showing the lesions once again, in this case on the penis. Once again, more prevalent in males because the genitalia is external. And then under the microscope, you can see what it looks like. We move on to viral infections. Genital herpes is a double-stranded DNA. Herpes, usually it's herpes simplex virus 2 or HSV2. Sometimes it might be HSV1, but usually it's going to be 2. This is often asymptomatic. It can be transmitted by sexual contact, or if you have contact with an open lesion, it can be passed on that way. It can go latent and then reoccur later. Is there any way to determine when the reoccurrence is going to be? No. There is no cure or vaccine for it. There are antiviral drugs that will help keep it in that dormant state. And this is what the virus looks like when shown under transmission electron microscope. And genital herpes does cause these lesions. Like I said, contact with open lesions can help transmit it. Neonatal herpes, double-stranded DNA. Also, this is the disease is called neonatal herpes. It's caused by HSV1 or HSV2. What happens is the newborn is infected during the birthing process. The virus can cross that placental barrier and infect the fetus during pregnancy. You can treat with antiviral drugs. If tests have been run and you know that mom is positive for HSV1 or 2, the recommendation is probably to do a C-section just in case the baby or the developing fetus has not been infected yet. Don't let it become infected during the birthing process. Human papillomavirus causes human papillomas or warts. This is abbreviated as the HPV virus. It is a double-stranded DNA virus. There's several different strains of the virus. Some strains can cause genital warts. Some strains are associated with cervical cancer. Oftentimes it's asymptomatic, so you're not showing any symptoms at all, and it's self-limiting. In terms of treatment, there's several different methods you can use for treating the warts. That's something that would be discussed between the patient and the doctor, and just figure out which is best for them for that particular situation. There is a vaccine that is available, the HPV vaccine for the high. It's not for all strains of the HPV. Like I said, HPV virus, there's multiple strains. Not all of the strains are known. The concern is those that can cause cancer, especially cervical cancer. Not all the strains are associated with cancer. So the vaccine was developed just against the high-risk strains. So not all of them, but just the high-risk ones. This is showing some of the genital warts that can appear near the anus. and then near the genitalia. In this image, what you're looking at are cells that were taken from a cervical smear. Over here, these are normal cells. That's what it should look like. Notice the difference on this side. The cells look much larger, but look at the nucleus. It is so much larger and it's darker. That's not normal. Okay, so that would indicate that that is a cell that has been infected with the HPV virus. You don't want to see that. In terms of fungal infections, Candida albicans causes fungal vaginitis, which is the technical term for yeast infection. The fungus is part of the normal microbiota. Once again, how this happens oftentimes is there's a disruption in that normal balance again. In this case, something has happened. It could be you were on antibiotics. Maybe you were ill. Sometimes we see this with women when they're pregnant. The change in the hormones. It shifts things to make the pH decrease, so it's slightly lower. That's going to encourage the growth of fungi, and yeast are fungi. And so it's one of those things. You know, you're part of the normal community there, but when things get out of balance, boom, you take over. You can treat it with antifungal drugs. This is showing what it looks like with some of the spores. Here's the hyphae in here. And then here's one that's starting to sprout what we call a germ tube. This is the original cell. It's in the process of reproducing. And over here you can see these hyphal strands. In terms of protozoan infections, Trichomonas vaginitis is trichomoniasis, known just as trick. Once again, this is oftentimes part of the normal microbiota, but once again, you get an increase in the number when it gets out of balance. It is a sexually transmitted disease. It's usually asymptomatic. If a woman is pregnant, often it can trigger premature labor. And so it's something you need to be aware of as to whether or not she's going to deliver a premature infant. You can treat it with antimicrobial drugs. And this is showing what it looks like. Because it is protozoan, remember it's larger than what we're used to seeing in there. This was a gram stain, so these are some bacteria. This actually is a good slide to show you. Here are some gram-negative bacteria. I'm sorry, gram-positives in here. Look down here, there might be, over here there's some gram-negatives. Notice the difference in the size of your bacteria versus your protozoans. Remember, just as a refresher for size, your viruses are the smallest, then your bacteria, then your fungi, and your protozoans.